We are thrilled to welcome you all to another inspirational and educational episode of Concorde Conversations. Concorde Conversations is an initiative by Concorde Medical Group to educate, empower, and encourage our community about our health so we can all live to the fullest potential. Today's episode is Let's Get Back to Business, a discussion about lower back pain. Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program at Concorde Medical Group, part of Northwell Health. And today we are joined by our esteemed orthopedic colleagues from Lenox Hill, Northwell Health, and faculty of the Zucker School of Medicine at Hofstra University. I would like to introduce you all to the Chair of Orthopedic Surgery, Dr. Frank Schwab, and Associate Director of Orthopedic Spine Surgery, Dr. Jonathan Oren. Both are board certified orthopedic spine surgeons and experts in back pain. Many of you have already submitted amazing questions for our experts today. If you have any additional questions, please ask them in the chat box. We only have 30 minutes together, so we're going to go through as many as we can. Remember, we are giving general guidance. If you have a particular question about your health, we want to help you. Come in and talk to one of our exceptional Northwell physicians so we can answer your questions and give your health the attention it deserves. So let's get started. Thank you so much, Dr. Schwab, for joining us today. Can you tell us what are some of the most common causes of back pain?
So Catherine, that's a great question. And not a simple answer because lots of things unfortunately can cause back pain. But I would say probably the most common is really very benign back pain that happens because of a strain or overworking a muscle, or what many people say, I pulled a muscle, where a certain movement or doing too much can trigger tightness and discomfort in the back. And that's usually really benign, nothing serious, and usually clears up on its own. But there are lots of other things that can cause back pain, and some of them are a little more serious. And if it becomes a persistent problem that is ongoing and really limiting you, you should come and see one of us and have it checked out. That can include little things like a joint that has mild arthritis. Again, nothing serious, but something that can be really kind of bothersome. It can be a small injury to a ligament, sometimes an injury to the disc. So many people worry about herniated discs. And again, most of them are really benign and really not very serious, but lots of little structures in the lower back that can trigger pain. And it's really hard to tell just by your symptoms. So something is persistent. If it's really affecting your quality of life, get it checked out.
Got it. So welcome, Dr. Oren. So can you expand a little bit more about when you should see an orthopedic surgeon for back pain?
Thanks, Catherine. I think to just tack on what Frank said, really for me, when the back pain's getting worse, it's out of control, it's not responding to the conservative measures like over-the-counter treatments with Tylenol, Advil, anti-inflammatories, a little bit of gentle rest, some exercise, that's a good time to come in. Additionally, if you're starting to feel nerve type symptoms like pain or numbness or tingling that's going down into your legs or feet from your back, that's a great time to come in and see someone and get evaluated, because that may mean that there's something more insidious going on that we need to look at.
Well, Dr. Schwab, are there red flags? When do I need to see a doctor immediately?
Yeah, so really good question, because as I said, most of back pain isn't really serious, and most of it, our bodies are pretty good at taking care of, and things resolve on their own. But the situations where it's a good idea to come in and see someone on our team are just as Dr. Oren, as Jonathan just pointed out. If the pain travels down the leg, if there's any weakness, if there's any change in bowel or bladder function, if the pain is really severe that it's hard to function, or nighttime pain that wakes you up because it's so severe at night, then you probably ought to come in pretty swiftly just to make sure that it isn't something more serious that requires care. But a lot of it is pretty mild stuff. And again, I don't think you need to come and see a doctor if your back just aches a little, or if you did a little too much and it's sore the next day. So it's really these more serious symptoms that should prompt you to come in and see us right away.
Okay, Dr. Oren, one of the patients asked, could numbness in my feet be a result of lower back problems?
So that's a good question. It's something we get in the office all the time. Numbness in your feet can be coming from the back, right? Through the back area, we have nerves that travel through from our brains down through our spinal cord into our low back area, and that's kind of where they branch off into our legs. So it can usually isolated numbness just in the feet area itself, not in the rest. No other symptoms, no back symptoms, no other pains in the legs. I would say a lot of times that can also just be something else, like aging of the nerves in the feet, which we would call like a neuropathy. And there are many, many different kinds for that. So a lot of times we'll see patients for that, and we'll also be in contact with a good neurologist who will also evaluate you and sometimes do different types of testing than the imaging to try and understand electrically what's happening with the numbness.
All right. Dr. Schwab, sometimes it's confusing to know if my pain is coming from my back or my hips. How can you identify where the pain is coming from?
Yeah, that's a good question. So it's actually not as easy as you'd imagine. Sometimes we have symptoms in one part of the body, but it doesn't always correlate exactly with the problem right there. And we see that in neck problems commonly that cause shoulder pain, or shoulder problems can cause neck pain. And similarly, patients with hip arthritis or hip symptoms can actually have buttock and back pain, and vice versa. Someone can have a back problem and all they really feel is some buttock or leg symptoms. So it can be really hard to figure out. And if it's persistent, again, I think it's a good idea to come in. And if your hip bothers you more, then you might see one of our hip colleagues, and they might say, oh, it's not your hip, go see the spine guy. And we might see someone coming to us first and then refer them over. But a physical exam is really the best way to tell. So coming in and seeing someone for a quick exam, and usually we can figure it out pretty quickly.
All right, Dr. Oren, can you explain the difference between scoliosis, stenosis, arthritis, and osteoporosis?
Sure. So scoliosis refers to a deformity of the spine. So it's a three-dimensional problem where we have an S shape, right, to the spine. If you see a picture of someone's x-ray, there's a rotational aspect. So you'll see like one shoulder blade is more prominent than the other shoulder blade, or one hip is more prominent than the other hip because of that. And then also sometimes people have a sway back posture, or they're leaning forward because of that. So that's really more of the spine alignment. Stenosis refers to the ability of the nerves to pass through a structure in the back. So we have a bony structure where all the nerves will pass through. So if it gets narrow, that's what stenosis means, a narrowing, just like a stenosis in your heart or in your neck or somewhere else about a vessel. So that's really what stenosis is, and that really refers to sort of more nerve type symptoms that you would get from your back. Osteoporosis is a bone health term. So osteoporosis really refers to a bone density problem. So your bones are becoming more brittle with time. And I think the last one, you have to remind me which the
Arthritis.
Arthritis. So arthritis in the back refers to wear and tear of the joints. So just like hips and knees and shoulders that move and they have lubricating surfaces, so do our backs. Our backs have lots of little joints at every area. And so as those start to wear out, the cartilage in our backs will wear out with that, and you can get arthritis type symptoms there as well.
Going on the idea of stenosis, Dr. Schwab, what can be done about sciatica from spinal stenosis?
Great question. So pretty common for us to develop spinal stenosis when we get older. Just as Jonathan explained, it's the canal where the nerves are in that starts to get a little narrow. And unfortunately happens to all of us to some degree. But luckily, most of us don't have significant symptoms. But if you do have symptoms of, as you point out, like nerve pain traveling down, then usually we start with some medication by mouth first. Sometimes we'll consider an epidural steroid injection, which sounds scary, but it really just means delivering a little bit of medication right to where the nerves are getting squeezed. And for many people, that gives pretty good relief. And then rarely, if it's really persistent and really bothersome, there's a procedure where we can free up the space where the nerves are compressed. And often that can be done minimally invasively, where we just make a tiny opening. We just go right to that area, free up the nerves. Patients can go home the same day. So really effective when it's necessary. But luckily, most people don't need to get to that point, and an injection might be all that it takes.
Okay, Dr. Oren, when do you refer for spinal surgery?
So I think when you are feeling these nerve type symptoms, whether it's, if we're talking about the low back, so we're talking about pain, numbness, tingling that goes down the leg, or both of your legs, heaviness feeling that you feel in your legs, you feel like the muscles are cramping and you can't walk very far because the legs are getting tired. That's another sign of stenosis. And also when, the back pain in association with this is out of control, that can mean that you need surgery. And those are the things that we look for. In addition, when you come into the office, we'll test your strength. If we see that the strength in your legs is starting to get weaker, that's a sign that the nerve impingement is affecting sort of the health of the nerves and the electricity going to the muscles. And that's another time when we really feel like surgery would probably be better. But again, as Dr. Schwab said, we really want to try and maximize all these other treatments we can, because many people respond very nicely to them. And a subset of patients, either because their muscles are getting weak or they're really having more of the neurologic type symptoms that aren't being controlled well, that's really when we start thinking about surgery.
Great. So Dr. Schwab, what does spinal surgery entail? And there's a question in the chat box. What are the risks of spinal surgery?
So super question. I think a lot of it depends on what kind of surgery you're going to have. It's kind of like bringing your car and telling the mechanic, okay, what's it going to take to fix? And he says, well, hold on, I got to figure out what the problem is first. So a little bit the same way for spinal problems and spinal surgery. So as I mentioned, most patients don't need surgery. Some patients might need a procedure, and a lot of that is done less and less invasively with very small openings. And some patients need more traditional surgery that might be, a bigger opening. So in general, surgery will entail coming to the hospital the morning of your procedure. Then you have your procedure. Most of those that used to be these very long procedures are much shorter. So we pretty effectively can do most surgeries within a shorter period of time than we ever could before. Maybe it's an hour, maybe it's a couple hours. Patients wake up, we have really good anesthesia. Most patients wake up and have very little or no pain. And then the goal is, we've learned, is to get patients up and going as quickly as possible. So there are patients that go home the same day. Many patients will stay one night, maybe 2 nights in the hospital to get more physical therapy and recover. But we've really shortened down sort of the recovery time and what it means to have spine surgery from what used to be, weeks in the hospital is days, and what used to be days is sometimes just overnight or going home the same day. So that's kind of the range of spine surgeries. And then I think the other question that you had was, what are the risks? And the risks will depend on the procedure. So the biggest risk I always tell my patients is your overall health. For patients who have other health conditions, let's say they have a bad heart or they have diabetes and the blood sugar isn't well controlled, or hypertension, those are sort of riskier patients than those who are healthy. The procedures themselves are extremely safe nowadays. We do all sorts of things in the OR to make it super safe, just like flying in an airplane is super safe nowadays, right? So lots of checklists and lots of technology. So I always say the main thing is that your health is optimized before surgery, and that our medical team and the anesthesia team has made sure that it's really safe to go ahead.
Great. So Dr. Oren, if surgery is recommended, is it safe if I wait? Are there consequences to avoiding surgery if recommended?
Wait, it's usually not a big consequence. If we're talking about months or a couple months, or waiting from, okay, it's May now and I'd really like to enjoy my summer and I want to do this at the end of the summer. So if it's something that's a chronic condition, you're feeling pain in your back and leg, your muscles are strong, we're not having as much of the sort of neurologic end sort of dangerous stuff. Most of the time, waiting some period of time is okay. Putting it off by a long time for those types of patients can mean that the spine can sort of undergo more sort of wear and tear during that time. The nerves can get tighter. So you may start to feel more nerve symptoms or start to get that weakness in your legs, which we're trying to get to before that happens. Or you might see that the spine starts to become a little bit more unstable. It starts to deform a little bit more. And so therefore the kinds of things that we need to do to fix it become sometimes a little bit more. I would say the majority of the time it doesn't change a whole lot. I'd say it changes kind of minimally. And then there's that subset of patients who come in and they can't power their feet or legs. Those are patients we'll counsel and say, you really got to do this, in the next couple of weeks, or within the next week or even within that week, and that's kind of a different subset. Those are the smaller sort of group of our spine patients, and certainly those ones we really don't want to wait on. But I would say the majority can probably wait through a season or something like that.
Okay, there's a question in the chat box. What's the difference between surgery done by an orthopedic surgeon versus a neurological surgeon for the spine?
Wow, good questions. Yeah. Well, it probably doesn't make a difference because traditionally, orthopedic surgeons were trained to deal more with structural issues of the spine, and neurological surgeons more with nerve and spinal cord issues. But over the years, we've collaborated so much, and particularly at Lennox, where we operate together, we have conferences together, and all of us have been trained in fellowship. So we get additional training after our basic training. So we all get trained in spine surgery. So I think nowadays it really doesn't make much of a difference. And the good thing is that we've collaborated so much that we all have the same sort of technologies and the same source of knowledge. There are some rare cases where I might say, gee, that's probably something that's better done by an orthopedic surgeon. And other cases where I say, that's probably better by a neurological surgeon, but it's really for very rare conditions. And John has done a phenomenal job here at Lennox, really developing a great collaboration with the neurosurgeons. Every week we have conferences and we share things. So it's really a great combined team.
Absolutely.
Do you want to comment on that, Dr. Oren?
Yeah, no, I just want to echo what Frank said. I think that, now, coming through training, I trained in the last 10 years. So, maybe that decade before, or even the decade before that, I think the differences were pretty stark. When I went through, the procedures that everyone's doing are really the same. I happened to train with both neurosurgeons and orthopedic surgeons during my time. But we've all sort of started to meld together. And even when I started in spine surgery, the conferences were either orthopedic attended it or neurosurgery attended. The society meetings were separate. That's really changed a lot over the years. And now here at Lennox, we've really led the charge to combine the services, really work together in a really integrated fashion from outside the operating to inside the operating. But even in our societies, we see both orthopedic surgeons and neurosurgeons under the same roof talking together about similar things. And so I think that on the academic side and also just on the functional level, we've really melded together nicely. I think it's been
well, I would just say it doesn't keep us from making fun of the neurosurgeons. We're better, but
I understand that, but collaboration is key.
Yeah, no, it's really a phenomenal team here. And I would say it's not just orthopedics and neurosurgery, it's also the pain service and the neurologists and the physiatrists. And we have conferences with physiatry. So we're really, it's really a pretty sizable team. And I think people don't always see that from the outside, but we spend a lot of time really collaborating well.
Let's talk a little bit more about collaboration with physical therapy. When do you refer for physical therapy, Dr. Schwab?
I would say physical therapy, kind of see it as two important roles. One is for the patient that really doesn't need surgery and doesn't need a procedure, but needs a little coaching, a little help in better body mechanics, how to strengthen your back, how to, recondition yourself. And then there are those patients that have maybe had a procedure or have a chronic back condition, and they need more a sustained back program targeted to their needs. And we work very closely with them. We have physical therapists that see our patients after surgery on the same day, still in the hospital, to start a program to get them going, and then ensures that once they leave the hospital, they continue to get a physical therapy program. And then the patients always say, well, you don't need a procedure, but you need a coach. You need someone who's going to help you get fitter and take better care of your back. And so both of those are really important roles for physical therapy, and where we really have them closely engaged.
Okay, Dr. Oren, what if they undergo physical therapy and it didn't help them that much? Now what?
So if you went to physical therapy referred, let's say, by your primary doctor, or you were self-referred to physical therapy and you've been treating the condition, it hasn't gotten better, that's a really good time to come into the office to be evaluated by one of our team. That might be with either Dr. Schwab or myself. That might be with one of our physiatrists, who we work very closely together with, kind of that big team sort of approach that we have. But starting to figure out what's going on and trying to understand what's the source of the discomfort or pain that you're experiencing. If I sent you, or one of us has sent you to physical therapy and it hasn't gotten better, that might mean that we're moving on to the next step or next sort of phase of treatment. And that might mean things like injections. It might mean different medications, a different approach, different diagnostics. Or if we were sort of worried that, we're going to try this, and if it doesn't work, we're going to try surgery, it might need surgery. But it just means that aspect hasn't worked. And that's kind of what that means to me.
Okay, Dr. Schwab, why do I have more back pain when I walk compared to when I exercise?
So as we talked about, the back's pretty complicated, right? Because of all the different structures that have to work well together. And depending on how well your spine is functioning, there can be certain positions or activities that provoke pain. Some people actually have more pain sitting than standing. That's pretty common for people who have, let's say, a disc condition. They can't sit in a car for a long period and sitting's uncomfortable. They're much happier standing. Others find that movement is a lot better than standing, and walking is better because you're moving the muscles and you're getting good blood supply. And actually the muscle doesn't have to tighten the whole time. And so walking can be easier than standing for others. And then others, depending on the condition, find that exercise helps them feel like they have more stability in their spine than when they just stand and don't move. So it's a lot of it is related to what the underlying trigger is for the pain. And depending on that, different positions, different activity levels can either aggravate or alleviate the symptoms. So it's sort of complicated. It's kind of a long answer to it, but a lot of it's dependent really on the individual patient.
Okay, Dr. Oren, what's the best type of shoe to prevent back pain? I guess my stilettos aren't very good.
So yes, the stilettos probably aren't very good. And that's a good example of how shoe wear can affect your mechanics of your body. And this isn't just our spines, but this is our ankles and our knees and our feet and our hips and our spines and our necks. And all of those things are linked together in our sort of so-called kinetic chain. And when you're wearing your stilettos, your knee is sort of driven into what we would call extension or really like sort of severe straightening. And then you have to arch your back to accommodate that. So if you're wearing your stilettos and your back hurts, it's probably because whatever your position is aggravating the muscles or something inside your back that's making it sore. So on the flip side, what's the best shoe to wear? I think, wearing a good supportive shoe for your foot so that your foot and arch are supported. So your sort of joints and your ankles, your feet, your knees are appropriately sort of conditioned. I think that's probably the best thing for your back. And there's a lot of different shoes that do that.
Hey, Dr. Schwab, can you recommend a good pillow for back pain? Is there a pillow that keeps the spine in optimal position? Do you need firm support, soft support?
Right. Actually, I sell pillows. It sounds promotional. No. Well, I would say the most important thing is that it's comfortable. So there's lots of stuff, advertisements over beds and mattresses and special pillows. And the truth is, probably doesn't make a difference. I think if you had to go in one direction or another, a little bit firmer is better than very soft in terms of a mattress. And for a pillow, it's really that you feel comfortable. It's not that the pillow is going to cure your neck or back problems, but if you sleep well, you're sure going to feel better. So if you have a pillow that's comfortable and then supports your head in the right way, that's the right pillow for you.
Dr. Oren, does bad posture, such as hunching over, cause back problems? And do back belts help?
It's a good question. I think that when you have bad posture, right, so a lot of that is muscles, right? So it's our muscles in our bodies are not able to hold our spine straight. So if you're moving your shoulders forward like that and you're moving your spine like that, it's not that the spine is unstable within that. It's just that your muscles are changing and you're therefore changing your spine shape as a result. And so a good way to walk, the way we want to walk, is with our shoulders back and our sort of hips, knees, ankles, necks, pelvis in line, right? Because that's sort of the functional position. There's been a lot of research into that in terms of what drives sort of how people stand. And there's a wide range, but when the muscles aren't supporting our backs, it definitely hurts. It hurts in terms of it can add pressure to our discs, it can add pressure to our joints, it can add pressure to other areas in our body. So I don't know if it can truly cause a structural problem within our spine, but I do think that those things make whatever we have in our bodies can be worse. So I think really doing good efforts to keep our bodies healthy and our muscles strong really helps set us up for having a healthy back.
Okay, Dr. Schwab, does my weight affect back pain?
So that's been studied a lot. It's actually interesting that patients who lose weight, if they're overweight, feel they have less back pain. But I think most of it is because they're overall becoming healthier. They're maybe sleeping better, they're exercising a little more, they're just paying more attention. There are people who are overweight and never have a back problem, and really skinny people have terrible back problems. So I don't think that weight itself is a big driver for back pain, unless you're really very overweight and also in bad shape. But I would say, while it's important to be close to ideal shape, coming from sort of the spine world and the back world, it's almost more important that you're fit and healthy. And fit and healthy nowadays, it means walking regularly, exercising, having a good diet, sleeping well. And some people are a little overweight, but they're not going to cure their back pain if all they do is lose the weight. So I would say being overweight isn't great, but regarding your back, if you had to change one thing and it's either losing 10 pounds or going to the gym every day, I'd say go to the gym. So more important to have a fit back than necessarily being a little overweight.
Okay, can you discuss what exercises or stretches are good for lower back pain, Dr. Oren?
So I'm a big believer in keeping the hips flexible, keeping the hamstrings flexible. I know from my own back, when those areas get really tight, my lower back hurts much more. And I think a lot of it is a function of how our backs move in relative to the hips. We sort of talked a little bit about that in the relationships in the hip and the back, and they're tightly linked. So I think working on your hip mobility with hamstring stretches, piriformis stretches, hip flexor stretches, those are kind of easy ones that you can do, and you can look them up online. They don't take very long to do. You can do them kind of every morning. It takes about 5 minutes. Doing some gentle kind of rotational stretches. I think those really help kind of keep our backs healthy. And then I would add to that, when we're doing our fitness routine and you're doing some cardio and you're trying to keep our bodies healthy and fit, adding a little bit of work to our core, keep our core strong. That's our abdomen, our back, our hip muscles. And there are lots of really good exercises for that are safe to do. Help us support our spines, and the less that we let that go, the better that we're able to sort of hold that good posture when we walk, when we move, when we sit. And I do think that those things really help a lot.
I am a big believer in exercise. So our last question of the day. So if you had one action step to recommend to our viewers to improve their health and start today, what would it be? Dr. Oren, what would you say?
I'd say get out and move. I think whether you move, whether it's you like to ride a bicycle, whether you like to, take a run outside, whether you like to go to the gym and run on the treadmill, I think just getting your body out there and moving is the best way to keep our backs and all the rest of our joints and the rest of our bodies healthy.
And Dr. Schwab?
Well, I think that's a super important one, exactly what John said. And it's sort of cliche, but it's like, treat your back like it belongs to your best friend, like take really, really good care of it. So I'd say exercise, keep your weight ideal. And I would also say, if your back really bothers you, don't be afraid to see a specialist, because you got so many great ways to treat it. And a lot of them aren't so scary, and they're really effective.
Well, great. Thank you both. Thank you all for joining us for another inspirational and educational episode of Concorde Conversations. A very special thank you to Dr. Schwab and Dr. Oren for joining our conversation. We appreciate their expertise in educating, encouraging, and empowering our community. As part of the Concorde community, we hope you share our mission. Please pass along our emails and webinar links with your friends and family so everyone lives to their fullest potential. In addition, please like and subscribe to our YouTube channel. We want to hear from you, so please fill out our survey at the end and let us know how we can serve your needs better. We know many of you have additional questions about your health, and we want to help you. So come in and speak with our extraordinary Northwell physicians about your health. We care about your health. We care about you. Thank you for joining us today.
Thank you.
Thank you.